Methotrexate, also known as Xatmep, is a medication used to treat certain types of cancer, such as acute lymphoblastic leukemia and non-Hodgkin's lymphoma. It is also used to control severe psoriasis or rheumatoid arthritis that has not responded to other treatments. Additionally, it may be used to control juvenile rheumatoid arthritis. Methotrexate works by slowing or stopping the growth of cancer cells and suppressing the immune system. It is important to note that early treatment of rheumatoid arthritis with more aggressive therapy, such as methotrexate, helps to reduce further joint damage and preserve joint function. The daily dosage and optimal timing for taking Xatmep should be determined by a healthcare professional. Before you start taking Xatmep, make sure to read the patient information leaflet from your pharmacist. It's important to take this medication exactly as prescribed by your doctor. The dosage and frequency of Xatmep will depend on your medical condition and how you respond to the treatment. Taking Xatmep incorrectly can lead to serious side effects, so it's crucial to follow your doctor's instructions carefully. For the treatment of psoriasis or rheumatoid arthritis, Xatmep is usually taken once a week. It may take several months before you start to notice the full benefits of this medication. If you're using the liquid form of Xatmep, be sure to measure the dose carefully with a special measuring device/spoon. Don't use a regular household spoon, as you may not get the correct dose. It's important not to increase your dose or take Xatmep more frequently or for a longer period than prescribed. Your condition won't improve any faster, and you'll be at a higher risk of experiencing side effects. If you're pregnant or may become pregnant, it's important to avoid handling Xatmep or breathing in the dust from the tablets, as it can be harmful to an unborn baby. While taking Xatmep, be sure to drink plenty of fluids unless your doctor advises otherwise. This helps your kidneys to remove the drug from your body and can help to minimize some of the side effects. If you experience nausea, vomiting, stomach pain, drowsiness, or dizziness, make sure to inform your doctor or pharmacist. Temporary hair loss is also a possible side effect, but your hair should grow back after you stop treatment. It's important to remember that your doctor prescribed this medication because the benefits outweigh the risks for you. Most people do not experience serious side effects, but you should contact your doctor if you notice mouth sores, diarrhea, signs of anemia, liver problems, easy bruising, black stools, enlarged glands, bone pain, skin discoloration, signs of kidney problems, dry cough, or muscle weakness. Seek immediate medical help if you experience weakness on one side of the body, neck stiffness, severe headache, vision changes, irregular heartbeat, mood changes, or seizures. This medication may lower your ability to fight infections, so watch out for signs of infection such as a persistent sore throat, fever, or cough. A severe allergic reaction to this drug is rare, but seek medical help if you notice symptoms like rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, contact your doctor. Methotrexate, also known as Xatmep, is a medication used to treat cancer or severe diseases caused by an overactive immune system, such as psoriasis and rheumatoid arthritis. It is important to note that methotrexate has caused birth defects and death in unborn babies, so women should avoid becoming pregnant while taking this medication. Pregnant women with psoriasis or rheumatoid arthritis should not use methotrexate. If you have kidney problems or excess body water, you must be closely monitored by your doctor, as your dose may need to be adjusted or stopped. Methotrexate can rarely cause severe blood and bone marrow problems and stomach/intestinal disease when used at the same time as certain nonsteroidal anti-inflammatory drugs, NSAIDs. It is important to discuss with your doctor the safe use of these drugs if you are taking them in combination with methotrexate. In rare instances, methotrexate may also cause liver problems when used for long periods of time, so a liver biopsy is usually recommended for long-term users. This medication may also cause serious side effects such as lung problems, skin reactions, diarrhea, and mouth sores. Additionally, lumps or abnormal growths may rarely appear during methotrexate use, so it is important to inform your doctor if any new lumps or growths occur. When used to treat tumors, methotrexate may cause side effects due to the rapid destruction of cancer cells. It is important to stay hydrated and notify your doctor if you experience symptoms such as irregular heartbeat, low back/side pain, signs of kidney problems, or muscle spasms/weakness. Lastly, when methotrexate is used with radiation treatment, it may rarely increase the risk of tissue and bone damage. It is essential to discuss the risks and benefits of your treatment with your doctor. Before taking Xatmep, make sure to inform your doctor if you have any allergies or if you have a history of certain medical conditions such as liver disease, kidney disease, lung disease, alcohol use, suppressed immune system, or any active infections. Xatmep can increase your risk of getting infections or make current infections worse, so it's important to avoid contact with people who have contagious illnesses. Also, inform your healthcare provider if you are planning to get any immunizations or vaccinations. Be cautious with sharp objects and avoid activities that may result in cuts or bruises while taking Xatmep. This medication may also cause dizziness or drowsiness, so it's best to avoid alcohol or marijuana while using it. If you are planning to have surgery, let your doctor know about all the medications and herbal products you are using. Additionally, Xatmep may make you more sensitive to the sun, so it's important to limit your time outdoors and use sunscreen. It's important to note that Xatmep can affect fertility in both men and women. It should not be used during pregnancy as it may harm the unborn baby. Women of childbearing age should use reliable forms of birth control while taking Xatmep and for a certain period after the last dose. Men with female partners should also use reliable forms of birth control while using this medication and for a specific period after the last dose. Lastly, women who are pregnant or may become pregnant should avoid handling Xatmep or breathing in the dust from the tablets. If you are breastfeeding, it's recommended to consult your doctor before continuing to breastfeed while using this medication. When taking Xatmep, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Xatmep include acitretin, asparaginase, chloramphenicol, leflunomide, other drugs that can cause kidney problems, such as cisplatin, other drugs that can cause liver problems, such as azathioprine, sulfasalazine, retinoids such as isotretinoin, penicillins, phenytoin, probenecid, procarbazine, pyrimethamine, sulfa medications, tetracyclines. It's also important to note that certain drugs that reduce stomach acid, such as proton pump inhibitors, PPIs, like esomeprazole, omeprazole, and pantoprazole, may increase the amount of Xatmep in your blood. This could increase the risk of side effects, especially with high-dose methotrexate treatment. Be sure to ask your doctor or pharmacist for details and ways to lessen the risk of side effects. And always follow your doctor's recommendations for the best time to take this medication. If you or someone else has taken too much Xatmep and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can call 1-800-222-1222 for your local poison control center, while in Canada, you can reach out to a provincial poison control center. Symptoms of Xatmep overdose may include severe nausea and vomiting, as well as bloody stools. It's important not to share Xatmep with others. Before starting this medication and while taking it, you may need to undergo lab and/or medical tests such as complete blood cell counts, liver and kidney function tests, pregnancy test, and chest X-ray. Remember to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Xatmep as prescribed by your doctor. If you happen to miss a dose, speak with your doctor or pharmacist to determine the best course of action. It's important not to take a double dose to make up for a missed one. If you are using the tablet form of Xatmep, store it at room temperature, away from light and moisture. Keep it out of reach of children and pets, and do not store it in the bathroom. If you are using the liquid form of Xatmep, follow the instructions on the product package for storage, or ask your pharmacist for guidance. Do not flush Xatmep down the toilet or pour it into a drain unless instructed to do so. Properly discard any expired or unused Xatmep by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.